Let's get into it. Over the last few weeks, the first rollout of COVID-19 antibody testing began throughout the United States. It's believed that these tests could be the key to discovering just how many Americans have had the virus and who may have built up an immunity. But there are a lot of questions here about it. Joining with more insight of antibody testing is Dr. Jake Deutsch, co-founder and clinical director of Cure Urgent Care Center. So good morning to you once again, Dr. Deutsch. We've been chatting with you throughout the whole thing here. First and foremost, many people know that you were positive for the virus. So let me ask you how you're feeling this morning now that you've recovered.
I'm feeling good, fully recovered, and I have antibodies. So that's pretty exciting progress to understand. I had a positive test, and we were able to test myself, and I have antibodies.
So explain to me what exactly that means, right? You hear the term antibody, and you're like, okay, am I good to go back to work? Am I good to go back into society? What is an antibody?
So basically, that means that you have a reaction. Your body has made a protein that's part of our immune system that's going to help prevent reinfection. We don't know what that means for COVID, whether this is going to be immunity for a week, for a season, for the year, or lifetime. But it is a bit of progress that we understand that people are making an immune response that we would expect. And it helps us identify different categories of people that we may not have identified actually had the virus, particularly people who are asymptomatic or what we call carriers. We're seeing a considerable amount of people who never reported symptoms, never had a contact, never had a test, and are showing positive for antibodies. So that's going to give us an idea of the true scope of infections, the number of people who were infected that we didn't even know when we're counting numbers.
Right, but there's a lot of unknowns here, right? So, from what I was reading about it this morning in terms of antibodies, you find out you have them in your system, and many people think, okay, I'm immune from getting this again. But the question remains is, how long are you immune for? And is that answer out there yet?
We don't have that answer. We can only base this on what we know about immunology and hopefully take some guidance there. But by no means are we telling people this is a get out of jail free card. This is only one more point of data. And I look at it as progress. Every day we learn something new about this virus, whether it's in the treatment, whether it's about how many people are infected. And here we're learning about antibodies. So this isn't the definitive decision about how people can reintegrate to normal activity, but it's one more point of data. And we're using that information with caution. But of course, it's progress. And I'm very proud in our practice. We've rolled out testing. We've tested about 1,000 people in the last 5 days. Yesterday, we saw 250 people. And that's a big chunk of people when you talk about the governors rolling out testing for 3,000 people a day.
So Cure Urgent Care, tell me exactly what the test is like. You yourself have gotten that test right there. I've seen that there are many different facets to the test, right? I read about a finger prick one, but you're doing things a little differently.
Yeah, so this is a serum test. So this is blood that's drawn, and like if you were having any other blood test, a blood count or a cholesterol level. The sample is then taken to a laboratory where it's tested, and the return time is about 48 hours. So what you're seeing on screen is the rapid test. That's a finger prick. The sensitivity for our testing is 97% versus the finger prick, which on a very, very optimal situation is about 84%. So we're talking about much greater sensitivity. We're talking about a lab-based test. So we're looking at much more, in my opinion, accurate data. And we're going to be doing our own independent study of our patients to get a sense of what those numbers really look like, because I think that that's going to give great insight into what we're really looking at when we talk about the real numbers of people who are infected or had silent infections as well.
So also, I was reading this morning that if you've had the virus or you think you've had the virus, you should actually wait some time before getting the antibodies, right? Because it takes some time for your body to actually develop them. So if you feel like you've had the virus, how long should you wait before you go get this test?
That's an excellent point, because ideally we are recommending about a 4-week period from the onset of the illness. So that's the window in which our body makes antibodies. However, many people are uncertain if what they had was COVID, so that makes it a little bit more difficult, but we're still trying to get a timeline close to that 4 weeks. And other people have no sense of illness. So then you're basically just stabbing in the dark. So when we test people, we're giving them the information about what to expect based on their exact situation. And then if there was a strong possibility that you were sick or you had a positive test and don't have antibodies, to then repeat that in a couple of weeks to see if it was just a matter of the timing not being correct.
Understood. I think what your point was excellent, though. If you do have the antibodies, it's not exactly a get out of jail free card, which I think a lot of people might think is, because they keep hearing that it's the key to reopening the economy here. Dr. Deutsch, I appreciate your time this morning. Thanks for walking us through this, and I'm glad you're feeling much better as well.
Thank you very much.